Right, good morning again, everyone, and just want to say that I've attended this Sudan Studies Society Symposium annually over the years, usually as an attendee. I've chaired panel before, and this is the first time I'm coming here as a speaker as part of a panel. I'm really grateful for Gillian for giving me the opportunity to talk to you today about our campaign at Sudan Doctors Union, Silence in Blue. So Silence in Blue is a campaign that aims to address the sexual and gender-based violence that has been occurring during the revolution during the 8 months since December 2018. The term Silence in Blue refers to the colour blue which has been associated with the martyrs and victims of the revolution over the last 8 months, and specifically the massacre on the 3rd of June, and the word silence is in recognition of the stigma that's particularly associated with sexual violence that stops survivors from reaching out and asking for help. During the uprising, many of you who were following the scenes over the WhatsApp groups, over the social network, over the news, saw a fantastic plethora of sort of beauty, I would say. It was an elevation of women's voices, leading discussions about policy, about feminism, about tribalism, talking about colorism, all types of topics. And that was remarkable, thinking about 30 years where sort of the regime worked hard at misogyny and tribalism, to see women united regardless of tribe and gender. Female strength was a feature of the whole revolution, and many of you had heard the word Kandaka being referenced to the peaceful women protesters, in a way a name that's in recognition of the old Nubian queen warriors. It's really remarkable that women's resistance and resilience has overcome all those efforts to make them invisible and silent in society over the last 3 decades. I'll show a few pictures, scenes we've not seen in Sudan for years, seeing women at that level, the beauty, the courage, being sort of icons of the revolution. And like I said, united together, men and women, gender became not a real issue when people were striving for peace. Courage, definitely, that's a photo, many of you have seen it, that young woman throwing back all these sort of tear gas bombs, that was just remarkable. And the beauty and the art that we saw during those months of 6 weeks of sit-ins, again, seeing women at that level was quite remarkable. It was quite hope-instilling in all of us, and we felt a lot of pride in how the revolution was conducted, thinking that women are getting that place finally in society. Unfortunately, the massacre on the 3rd of June, that was a heinous, unwarranted and deliberate crime really by the regime to dismantle the agency of Sudanese people, very much to strike fear, to stop the spirit of the revolution. And the scenes that we heard about, because at the time there was the internet blackout, and what we saw later on videos was very much like pictures you see in Games of Thrones, barbaric pillaging, torture, handling of women in the most obscene ways. It was just barbaric in every way possible, quite shocking, the burning of tents, and really it was very much about oppressing people and destroying the spirits. I put in Maslow's hierarchy of needs because at that point we suddenly, from talking about beauty and all that sort of high level we were talking about during the sit-in month, suddenly we're back to looking at security and food and safety. Quite distressing scenes, to be quite honest. And it was very much a demonstration of collective violence that has haunted Darfur for years. We saw snapshots of it on that day, on the 3rd of June, where in relation to this campaign, the sexual violence was used as a weapon of oppression, specifically to silence the revolution. At the Sudan Doctors Union, we started working actively with colleagues on the ground to try and confirm what was going on, and we were able to confirm the significant numbers of rapes and sexual assaults that had been going on since December, and young women who were detained in sort of holding places in the cars where they were sort of, and even sort of just in neighbourhoods. But the attacks really escalated on the 3rd of June. Women were, it's quite sort of distressing what we used to hear, but when I went to Sudan recently, I've met with a few survivors. We're talking about not just sort of groping or harassment. It was rape, it was gang rape, It was use of sticks in the most obscene and brutal manner, and even a couple of men were equally sexually violated. A verbal account of an activist who was brutally raped, it brought to mind the silence code that sort of doesn't allow women to reach out for help. Fear of stigma, fear of shame, fear of, again, of the security situation at the time. We at the time immediately reached out to our colleagues in Khartoum to try and facilitate post-exposure prophylaxis for HIV/AIDS, for emergency contraception pills, for antibiotics, and we continue to liaise with other gynecologist colleagues in Sudan to support women presenting with genital injuries, and of course with psychiatrists and psychologists, recognising this is going to be a long-term process of support that has to be put in place. The sexual violence continued to be a risk at the time, particularly for female health workers and support workers who were particularly targeted by the oppressive regime forces. And since then, there has continued, there's still going on, there's still, until June, there were a few rape assaults confirmed, and sort of women, a couple of women that I've met couldn't sort of even press charges. They weren't allowed to complete the Form 8, we call it, or nectomania. And the policeman at the station was fearful of writing the report because of the genderweed who perpetrated that. I sometimes say genderweed, even though we recognise that it's probably been a mixture of the regime forces beyond the genderweed themselves. Silence in Blue, as a campaign that we started, is mainly to address the stigma surrounding the sexual violence, so that people feel safe and supported to come forward. We believe that this could happen through meaningful conversations with survivors, and this is very much based on, again, what the United Nations Security Council resolution, which was opportune really early this year, affirms that a survivor-centred approach is required to address conflict-related sexual violence. We look to working with the different Sudanese communities across the country, with colleagues locally, to try and sort of inform and manage the stigma situation. The other aim for Silence in Blue is the long-term commitment of psychological and medical aid. There has to be sort of targeted preventative measures to reduce the mortality and morbidity in conflict and post-conflict situations. Again, we look towards reducing the untreated sexually transmitted diseases, and allow people to approach professionals to get help without feeling ostracized from their communities. It quite saddens me that there were a few women who had to have terminations because they could not reach care very early on following the rape assaults at the time. The third component is about training needs. We do recognise there is an issue about training for investigating sexual violence, for monitoring it, how documentation should happen, just as integral for the nation to move forward. And whilst we're currently enjoying the joyous situation and full of optimism regarding our newly appointed civilian government, we do have to be realistic in expectations, and considering the current complexity of the political situation and fragility, there will come a time where we need sort of reliable documentation to be able to seek justice appropriately. Sudan is at a crucial point in its development. We are at a point where we can look to choose how we want to move forward. And it's important for us to have these platforms of conversations about things that we've kept silent for years and years, Darfur being an example. Thinking about this, when we have conversation, we look at other examples in other countries. For example, Rwanda, after the genocide, they have a unique experiment in national reconciliation and how they enforce social re-engineering for over the last 2 decades following the genocide. It is remarkable to see how far they've come in being now the 6th out of 149 countries as far as global gender gap index, while the UK is at number 15. So thinking about that, this is very much looking at research. There's a positive correlation about how economic progress happens with gender equality and addressing gender issues, and women being given equal opportunities. In summary, really, the challenges and the main aims of the campaign are to address the stigma, training issues, advocacy, policy reform, looking at laws. Again, not knowing much about law, I was shocked to hear that probably many of you know this already, that rape and adultery were under the same law not that many years ago. So a woman raped could easily sort of be lashed after that situation. So lots of policy reform and legal work that needs to be done, where we need to work with different stakeholders. And again, about capacity building. I think sort of at this point we are at a pivotal point. It is quite encouraging to see the new civilian government with 4 ministers for major sort of ministries, Asma Hamad Abdullah, Intisar Zain Nasrayron, and Lina Sheikh and Wala Islam al-Bushi. This is encouraging. It is a positive way forward, and I'm hopeful that appointing women in pivotal key positions would work towards supporting a move forward. Sudan is a beautiful country. It is rich with its vibrant cultures and traditions, and we look towards realising the dream we saw during the few weeks of the sit-in. Thank you very much.